Possible. We now come to the NHS winter update. Secretary of State, Victoria Atkins.
Thank you very much, Mr Deputy Speaker, and with permission, I would like to make a statement on the winter pressures facing the National Health Service and social care, as well as the impact of the ongoing junior doctors' strikes. The NHS employs 1.3 million people and the social care system a further 1.5 million people. Together they treat and care for tens of millions of people every day. We all know that winter is the most challenging time of year for the NHS and social care, as our workforce has to tackle the pressures created by cold weather and seasonal viruses. To put our health and social care system in a strong position heading into winter, this year we started preparing earlier than ever before. In January last year, we published our recovery plan for urgent and emergency care and provided £1 billion of dedicated funding to boost emergency capacity. This plan committed to delivering 5,000 new permanent staffed beds. I'm pleased to update the House that more than 3,000 were already in place in December, and in the coming weeks, NHS England will meet the 5,000 pledge and will make sure that they have almost 100,000 core beds ready when COVID and flu peak. Our recovery plan also pledged 10,000 virtual ward beds so that more patients can be monitored safely at home away from hospital. And I'm pleased to update the House that we have delivered more than 11,000 virtual ward beds, and they have been a vital service for eligible patients over the festive period. We've boosted our ambulance service with £200 million of additional funding, putting new vehicles on the road, improving response times and getting crews out and about for more hours. And in recognition of the importance of patients being discharged promptly from hospital when it is safe to do so, we've made sure every acute hospital in England has access to a care transfer hub, bringing together teams from the NHS and social care to speed up discharge, backed by an extra £600 million for social care. And to help prevent the spread of winter viruses, we brought forward flu and COVID vaccinations, protecting the most vulnerable and making them less likely to require hospital treatment. But, Mr Deputy Speaker, no matter how thorough our preparations are, winter will always be the most challenging time of the year for our NHS. That is why it is extremely regrettable that the BMA's Junior Doctors Committee has chosen to strike not once, but twice at this time of year. They have also chosen to strike for an unprecedented length of time, putting profound pressure on hospitals and GP surgeries throughout the country. Before Christmas, the BMA's strike caused the cancellation of almost 90,000 appointments, some of which will have to be rescheduled for a second or even third time. This is in addition to the 1.1 million appointments that have already been affected since strikes began in December 2022. This isn't just another statistic. There is a person behind every one of those appointments who may be in pain or distress and who now must wait longer for the care they deserve. Last week, a member of the BMA leadership said strike action benefits absolutely nobody. They were absolutely right on that. The ongoing strikes are causing more appointments to be cancelled, they're causing more worry for patients, and they are putting a significant strain on staff. During December's and this week's strikes, the NHS's priority has been to protect patient safety. Resources have been channelled into urgent and emergency care, including vital neonatal and maternity services. Huge efforts were made to make the most of the working days between Christmas and New Year, because throughout any strike action, it is crucial that every patient who needs urgent medical care comes forward as normal. We continue to face challenges, and strikes have stretched emergency care. But thanks to the meticulous hard work in local trusts, that went into preparing for strikes, as well as the huge personal sacrifices that clinicians and staff are making to pick up the slack, emergency care has largely held up and the system has coped under the circumstances. Mr Deputy Speaker, staff across the NHS deserve our sincerest thanks for the heroic efforts they have made throughout these unprecedented strikes. I would like to thank the doctors, the nurses, the paramedics and all frontline staff who have come into work to support each other, to deliver care and to protect patients. The consultants, including members of this House, who are working extra hours, cancelling their holidays or even coming out of retirement to safeguard patient safety. And the managers, administrators and NHS leaders who are working night and day to make sure the right staff are in the right place to protect patient safety. And all of those working in social care, from local authority staff to care workers and carers who have rallied round to support hospitals, I say thank you. I know that work doesn't stop when the strikes stop. NHS staff will begin turning their attention to recovering from the impact of the industrial action, restarting elective treatment and improving the flow of patients through emergency departments. The Junior Doctor Committee's choice to strike at this time of year means that this work must now be done under additional pressures as staff move to catch up from industrial action as well as tackling the impacts of cold weather, COVID, flu and norovirus. Now, I want to find fair and reasonable solutions to industrial action. One of my first acts as Health and Social Care Secretary was to bring in the British Medical Association for talks to end these long-running disputes, as well as meeting representatives for Agenda for Change unions who speak for frontline staff, including nurses. We've reached agreements with unions representing consultants and specialty doctors on offers to be put to their members. These offers will modernise contracts, realign pay scales and improve doctors' career progression while delivering value for the taxpayer and protecting the hard-won progress we have made to halve inflation. Consultants and specialty doctors are pausing strike action while their members vote on these offers, with the results of both ballots expected shortly. The Government and the BMA agree that these are the best deals available to us, and I very much hope that members will vote in favour so that these positive changes can be made and we can move the NHS forward in the future. In relation, though, to junior doctors' negotiations, talks began in November had been progressing with the BMA Junior Doctors Committee. These talks were constructive, exploring a range of proposals that would improve the working lives of doctors across the NHS. I was, therefore, extremely disappointed when the BMA turned their back on these negotiations before they had concluded to call the damaging strikes that we face today. This government will not negotiate with the BMA while strike action is underway and patient safety is at risk. Because every strike is hugely disruptive for our NHS. The NHS and patient safety cannot be switched on and off on a whim. But I don't believe it's right to negotiate with unions whilst they are being unreasonable, and some of their members are walking out of hospitals at the busiest and most challenging time of year for patients. And Mr Speaker, I remind the House that the Junior Doctors Committee's headline demand of a 35% pay rise is simply unaffordable for taxpayers. Last summer, we accepted the recommendations of the independent pay review body in full. This means that junior doctors received average pay rises of almost 9% in their September pay packets, some of the most generous increases across the entire public sector. Meeting the 35% demand would stoke inflation just as we as a country have halved it. burning a hole in the pockets of families up and down the country. And it would be totally out of step with the pay rises awarded to other dedicated public servants and employees throughout the private sector. Staff across the public sector have agreed fair and reasonable deals on pay. Only the Junior Doctors Committee has repeatedly walked away from talks. Now, Mr Deputy Speaker, I want to address the issue of NHS leaders asking some junior doctors to return to work when patient safety is at risk. These are known as patient safety mitigations or derogations. As of 9:30 this morning, 40 patient safety mitigations have been submitted during this round of strikes. 2 have been accepted by the BMA. NHS leaders, many of whom are themselves members of the BMA, have decades of combined experience. They know their patients and they know their rotas, and they would only ask for mitigations if they were absolutely necessary in, for example, a children's emergency department. They are totally independent of government. It is for them to make those decisions. I trust them and I trust their judgment. That is the reality and the truth about patient safety mitigations. Now, one of the reasons I came into politics is because of the NHS and what it has done for me and my family. It is also one of the reasons I am a Conservative. This is a government that has delivered record NHS funding, the first ever NHS long-term workforce plan, and 50,000 more nurses for our NHS. We are providing the NHS with the doctors it needs for the future by doubling medical school places, opening 5 new medical schools, and pioneering one of the world's first medical apprenticeships. We have also supported doctors by making changes to pensions for those at the very top of their career path, which at that point was the BMA's #1 ask, a policy that seemed to be opposed by the members opposite. These are not the actions of a government that is turning its back on the NHS, as some have declared. These are the actions of a government that is building a health and social care system that is sustainable for the long term. To do this, we must put the strikes behind us and move forwards together. Because the NHS doesn't just belong to the Junior Doctors Committee, it belongs to us all. It belongs to the millions of people who rely on it being there when they need care, as well as the millions of taxpayers who pay for it. For their benefit, it is time for the Junior Doctors Committee to show that they're serious about doing a deal. They have legitimate concerns about their working lives, and a fair and reasonable deal can be reached. But calling damaging strikes is not the way to achieve this. Earlier this week, I said that if they called off their damaging strike action, I would get round the table with them in 20 minutes. I am, of course, extremely disappointed that they have refused my offer and continue to refuse the offer because, of course, the strikes are ongoing as we speak. But if they come to the negotiating table with reasonable expectations, I will sit down with them. Mr Deputy Speaker, this government has a clear long-term plan for the NHS. Our recovery plans in elective, emergency and primary care can improve access to treatment, transform services and give patients more choice and control over their care. Our long-term workforce plan will give the NHS the staff it needs to thrive for decades to come. Our social care reforms will build a better care workforce to support our growing number of older people. And by creating the first smoke-free generation, we will reduce long-term pressure on our health service. We've eliminated the longest waits, but we haven't yet made a significant enough reduction in waiting lists. To do this, we need the Junior Doctors Committee to come back to the table and do a deal that's in the interests of patients. It is in the interests of our NHS, and it is in the national interest. Then we can build an NHS that is not only stronger today, but stronger for our children and our grandchildren. I commend this statement to the House.
Opposition front bench. Shadow Minister West Streeting.
Thank you, Mr Deputy Speaker. I thank the Secretary of State for advance sight of her statement, and can I wish her and the whole House a very happy New Year. Unfortunately, the NHS is beginning 2024 the same way it ended 2022, on strike. This week's industrial action by junior doctors is the longest strike in the history of the NHS at the worst possible time, because even before the strikes this week, the NHS was struggling to stay afloat this winter. Hospitals were declaring critical incidents before the strikes. Patients were waiting dangerously long for ambulances and in A&E before the strikes. Ambulances were queuing up outside hospitals for hours to hand over patients before the strikes. The truth is, before the strikes and before the pandemic, the NHS has been facing winter crisis after winter crisis as a direct result of the Conservatives' failure. Their failure to train enough staff, their failure to arm the health service with modern technology, and their failure to reform. In January last year, the Prime Minister published an urgent and emergency care recovery plan promising, and I quote, the largest and fastest improvement in emergency waiting times in the NHS's history. Instead, heart attack and stroke victims are waiting even longer for an ambulance, and A&E waiting times are the worst they've been all year. The Prime Minister promised 800 more ambulances, but the government has now admitted they are just replacing existing ambulances. He promised 50,000 patients a month would be treated in virtual wards, but in reality it's fewer than 8,000 patients. Isn't the truth that the Conservatives once again sent the NHS naked into the winter and patients are paying the price? Given how ill-equipped they left the NHS, and given the desperate pleas from NHS leaders for these strikes to be resolved, why on earth did the government choose to sit back and let this damaging strike action go ahead?
That's right.
Not only did the Health Secretary allow talks with the junior doctors to collapse, not only did she refuse to reopen negotiations until tomorrow, when the damage will have been done, at the 11th hour, as junior doctors stood on the edge of this strike action, she chose to push them straight into it. In what way was it helpful for the Secretary of State, in a series of broadcast interviews, to patronise junior doctors by rebranding them as doctors in training?
That's right.
A junior doctor can have 10 years' experience under their belts. They do not expect to be trolled by ministers who have been in office for barely 10 minutes. In his interview on the BBC yesterday, we saw why the Prime Minister has allowed these strikes to go on for so long without intervening himself. He is using industrial action as an excuse for the state his party has left the NHS in after 14 years. And he would rather blame NHS doctors and nurses than take a shred of responsibility himself. Meanwhile, patients can't get an appointment, can't get the surgery they need, can't see a GP, NHS dentistry is decaying, and the NHS itself is on life support. And while the Prime Minister was bragging about all the parts of the NHS that aren't currently on strike, because that's how low he now sets the bar, he seemed to have forgotten that nurses are still in formal dispute. Is he so uninterested in our nation's health service that he didn't know? Was he trying to pull the wool over the voters' eyes, or is he just another Tory Prime Minister asleep at the wheel as he drives the country off a cliff? There was one thing the Prime Minister got right in his interview with Laura Kuenssberg yesterday. Whether the question was on the NHS, immigration or the economy, his response was the same. Ask the Leader of the Opposition. It seems even this Conservative Prime Minister knows that if you want serious solutions to the problems facing the country today, there is only one place to look, and that's the Labour Party. Patients are sick and tired of waiting. Waiting for ambulances, waiting for a GP appointment.
Order! The honourable gentleman has been here long enough to know that people do not give way during a statement. West Streeting.
Thank you, Mr Deputy Speaker. Patients are sick and tired of waiting. Waiting for ambulances, waiting for a GP appointment, waiting for their operation, and waiting for a general election that can't come soon enough. Why don't they get out of the way and let Labour fix the mess they've made?
Secretary of State.
Well, Mr Deputy Speaker, may I welcome the Honourable Gentleman back from his world tour promoting his book. It's very nice to meet him for the first time across the dispatch box. Whilst he was away in sunnier climes, he may have missed what is actually happening in Wales, which interestingly has been described by the Leader of the Opposition as the blueprint for how Labour will run if they were ever to come into government. Interestingly, in Labour-run Welsh the Welsh NHS, people are almost twice as likely to be waiting for treatment. And they are waiting an average of 5 weeks longer for NHS treatment under Labour in Wales than they do in England. And indeed, the number of patients in Wales seeking treatment in England has increased by 40% in 2 years because of the experiences they're having in Wales. But I'm just going to correct him on a couple of other things as well, just to help him understand the 800 new ambulances. Those are new ambulances. We are delivering them at pace. That is at the request of the NHS. And as is indeed the 5,000 extra beds that we are putting in across hospitals across England, because we understand the point about capacity and we want to help the NHS look after people in a timely and efficient manner. I'll just again also correct him on the doctors in training point, and I'm surprised he's come into it at this point. Had he spoken to his friends in the BMA, he'd have understood that that phrase is the phrase that the BMA are using themselves, because they have passed a motion to stop using the phrase junior doctors. And the Honourable Gentleman, the BMA passed a motion. And the Honourable Gentleman says refer to doctors. Again, he perhaps doesn't understand the complexities of contractual negotiations. This phrasing is used in order to denote those professionals who are still on formal training pathways, who are not specialty doctors, who are not consultants. This is the terminology that has been agreed with the BMA. But in terms of the strikes themselves, I note, and indeed I know that those behind me noted as well, the Honourable Gentleman didn't actually condemn the strikes. I'm very happy to give way if he'd like to confirm whether he condemns the strikes. Unfortunately, he's missed his chance to do so, but I suspect everybody, the patients at home waiting for appointments, will see the Labour shadow minister's failure to condemn these strikes, and that is because, Mr Deputy Speaker, in line with the public sector strikes more generally, the Labour movement will always prioritise union harmony over patient safety. That is not what we as Conservatives do. We will always put patient safety first.
Chairman of the Health Select Committee, Steve Brine.
Happy New Year. Secretary of State will know that it is far from all doctors in training who have taken part in this strike. In my trust, Hampshire hospitals, it's just over 60%. The average across the South East was little more than 50%. Many doctors were hard at work this past week caring for their patients. But does my right honourable friend share the concern of many in the health service that the longer this dispute drags on, we were losing the goodwill of the consultants who've been filling in, and we're doing serious damage to the career pipeline that sees today's doctors in training becomes tomorrow's consultants?
Well, may I thank my honourable friend for asking that question, and indeed for noting the enormous efforts that clinicians across the NHS have gone to in order to cover these strikes. We are very conscious of the personal impacts this has had for many. As I say, clinicians have had a very tough few Christmases, and we were all, I think, collectively hoping that this Christmas would just be a little bit easier for them. But sadly, these strikes have the real-term impact on people who are working to pick up the slack from junior doctors not turning up. I'm very, very grateful to everyone who has gone into work, who has worked extra shifts, who has cancelled time off with their families, and we must find a fair and reasonable solution to this industrial action, which is precisely why I was so very disappointed that the BMA Junior Doctors Committee chose to walk away from these discussions.
SNP spokesperson, Amy Callaghan.
Thank you, Mr Deputy Speaker, and a very happy new year to you. Our NHS faces an unprecedented winter of pressure with inflationary costs, increasing viral infections and staff shortages. Whilst the SNP Scottish Government have acted with £300 million to cut waiting lists and negotiated with NHS staff, preventing even a day of strike action, NHS England is undergoing a junior doctors' strike, the longest in the history of any NHS in the UK. Now, no one wants strike action, but, Mr Deputy Speaker, it works, which is exactly why the Tories want to ban it. In fact, this Tory government appear to be working to make this winter harder by cutting NHS capital funding, undercutting attempts to recruit new staff, and of course not getting round the table with trade unions, and instead blaming the BMA and junior doctors. Is the decision to underpay NHS staff and stoke strikes the policy of this Health Secretary, or is she being forced down this path by a Chancellor who's continuing his decade-long war on junior doctors?
Secretary of State.
Well, I imagine the Honourable Lady has seen the fact that we accepted in full the pay review body's recommendations this year and last year, and as of September, junior doctors and doctors in training have received on average an 8.8% increase on their basic salaries. Of course, they also earn money on top for antisocial hours, for working overtime and so on, and in addition to that they have pension contributions of some 20%, which is I think a rare employment benefit across both the public sector and the private sector. But in terms of the future, I very much want to find a fair and reasonable settlement with the junior doctors, as indeed we've been able to reach with consultants and with specialty doctors, but we cannot do that if junior doctors are on strike, and that is why it is so very disappointing that they walked away from the discussions. Yeah.
I'm sure we will all wish to welcome back to the House in rude health Sir David Ames.
Thank you very much, sir. Mr Deputy Speaker, I welcome my right honourable friend's factual statement today on the state of the NHS with her winter update. Can she confirm that she would return to the negotiating table immediately were the BMA to call off these very damaging strikes?
Secretary of State.
May I welcome my right honourable friend back as well and say, yes, I've said throughout this that I was extremely disappointed that the committee chose to walk away from discussions. I also happen to think, by the way, that there is a lot more to discuss apart from pay. I would like, and I've made this clear, I would like to look at other aspects of their working conditions. But unfortunately, the Junior Doctors Committee walked out, and it has had the impact we know with these strike actions. It's had real terms impact for patients, but we need to find a fair and reasonable solution to this. But I will not do this whilst the Junior Doctors Committee is maintaining strikes. They will have to come to the table with reasonable expectations and change their minds on the validity of strike action.
From the Health Select Committee, Rachael Maskell.
Thank you, Mr Deputy Speaker. We've had 14 Tory winters, and you would have thought they would have learnt by now that the real crisis in our NHS is because social care is not up to scratch. A quarter of patients in my local hospital are there waiting for social care, and as a result of jamming the back door, the front door itself then becomes inaccessible to so many patients. So when, after all these years, will she publish a proper plan for social care, or is she leaving it to my right honourable friend to take over?
Secretary of State.
I'm so sorry, I don't know who the Honourable Lady is referring to, but in terms of the Conservative plans, at the autumn statement in 2022, we announced up to £7.5 billion of additional funding, which was a historic increase. And we didn't stop there. This summer, we've announced an additional £600 million, which brings it up to £8.1 billion of additional funding over 2 years. This will support our care workforce, and the majority of the funding will end up in the pockets of the amazing people who provide care and support to the patients that we are all concerned about.
Dr. Caroline Johnson.
Mr Deputy Speaker, I declare my interest as a member of the BMA and as an NHS consultant who has worked during the industrial action. Make no mistake that these strikes are causing suffering to patients, both adults and children. The derogation process has not worked because, as the Secretary of State says, the BMA have not returned junior doctors to work when they've been asked to, when there has been a risk of dangerous harm to patients. The first duty of any government is to protect its citizens. So when will the Secretary of State bring forward the minimum service levels to protect the patients from these dangerous strikes?
Secretary of State.
Well, may I first of all thank very sincerely my honourable friend. I was in contact with her over the weekend as she had come off a very long shift in emergency care, looking after patients locally, and I have nothing but admiration for her and the many, many other people who have stepped in at short notice to cover urgent and emergency care in our NHS during these strikes. In terms of the minimum service levels work, she will know that we have already introduced minimum service levels for ambulance services, something that was opposed by the party opposite, but we have just closed the consultation on minimum service levels in hospitals, and we are, of course, carefully analysing the responses. But again, this point that 40 patient safety mitigations were made by NHS leaders and yet only 2 were granted by the BMA shows some very, very worrying concerns when it comes to how seriously the BMA is taking these concerns about patient safety.
Daisy Cooper.
Thank you, Mr Deputy Speaker. A few weeks before Christmas, NHS bosses were here in Parliament briefing MPs that notwithstanding their preparation for the winter crisis, the one thing that would push them to the brink would be a rise in respiratory illness. Now here we are. Cases of flu, COVID, RSV, whooping cough, they are all rising rapidly. A strong public health intervention by the government could have prevented this from happening. So when is the government going to get serious about public health interventions like vaccine uptake, air filtration, protecting the immune compromised to stop people from getting so ill so often for so long?
Secretary of State.
May I thank the Honourable Lady for re-emphasising, actually, the critical timing of these strike actions and the impact that it has on patients. We know that winter is difficult. It's not just difficult for our healthcare system. This is around the world. When cold winter strikes, it has physiological impacts on those people with underlying health conditions. But, of course, we also have a rise in infectious conditions as well. This is precisely why, on the advice of, as she will appreciate, clinicians, we brought forward the flu and COVID vaccination programme to try to protect the most vulnerable in our society. But again, the timing of these strikes is so very cynical because the impact of these strikes and the tail on these strikes will have, I'm sorry to say, consequences beyond tomorrow's stop date.
Dr. Therese Coffey.
Thank you, Mr Deputy Speaker. My right honourable friend, I was really concerned when she mentioned about the number of requests that have been made for the BMA to go into certain duties in hospital, and only 2 had been responded to positively. That is really concerning for patients. Contrast that to the behaviour of Nick Hume, the acting chief executive at NNN Hospital, who has transformed A&E there in terms of waiting times of hospitals. We need to promote leaders like that, but we need to unreservedly condemn the actions of the BMA Junior Doctors Committee and get these strikes over and done with.
Secretary of State.
May I thank my right honourable friend and also thank her for, of course, her work in the Department of Health. And she knows only too well the difference that an inspirational leader can make to a local NHS trust or at a regional level or indeed at a national level. And for those managers who are good, those managers who are committed to their local area, who work with their clinicians, who work with their other healthcare staff to try to look after patients all year round, they have been put under the most enormous pressure over the last few weeks because of these strikes. I thank every single one of them for doing what they can to safeguard patient safety, and as I say, I trust their judgment. If they have put those patient safety mitigations in, it is because they consider in their professional judgment that they are needed.
Dame Diana Johnson.
Thank you, Mr Deputy Speaker. The Public Health Director in Hull published her report recently, and she talked about the double jeopardy that my constituents face. From the most disadvantaged communities, they have shorter lives in far poorer health. At the end of last year, in A&E, patients were less likely to be treated within the 4-hour target than anywhere else in the UK, or in England, I should say. Why is that, after 14 years of a Conservative government that's committed apparently to levelling up?
Secretary
Well, I'm extremely grateful to the Honourable Lady, and she will know that our constituencies, albeit not in necessarily the same region, nevertheless share similarities, being relatively close to each other. In terms of the work and the progress made on urgent and emergency care, it is precisely because we were concerned about, for example, ambulance response times. We were concerned about hospital discharges, that we worked with NHSE to bring together the urgent and emergency care plan and, for example, bring about 800 new ambulances onto our roads, bring about 5,000 more core beds into the NHS to try to address these needs. Unfortunately, the strike action that we've seen over recent days has very much militated against those efforts. But winter is a very difficult time. We all accept that for the NHS, and through the urgent and emergency care plan, we have very much worked with NHSE to try to meet those demands that she so rightly puts forward.
Robin Walker.
Thank you, Mr Deputy Speaker. I welcome the Secretary of State's commitment to reaching a safe and fair and reasonable solution to these strikes. Worcester went into this winter with the delivery of a new emergency department and was able to deliver 25 beds worth of extra capacity over the winter. But nevertheless, I've heard from the hospital today that they're still facing intense pressure. Would the Secretary of State join me in paying tribute to the staff who are working around the clock to meet that pressure? And will she support the Swift Trust as it worked to try and address some of the key transport bottlenecks on their site, both in the interests of patients and staff alike?
Secretary of State.
Well, my honourable friend sets out, I think, very clearly the many pressures and factors at play in running emergency departments and indeed hospitals at the best of times when we aren't in the middle of winter, we aren't facing the pressures that always brings on the healthcare system. I thank both his staff, but of course staff throughout the country for all the work that they have done over the recent weeks to support the NHS, but also importantly to bring treatment to patients. And we are very much working hand in glove with NHSE, their regional and local leaders, to see if there are practical measures that can be taken to improve the flow through hospitals.
Tim Farron.
Thank you, Mr Deputy Speaker. The NHS winter pressure is having a huge impact on cancer surgery and other cancer interventions. In Cumbria, in the south of the county, 25% of those with a cancer diagnosis are waiting more than 2 months for their first intervention. And in the north of the county, 47% are waiting more than 2 months for their first intervention. We know, of course, that for every month delay in treatment, there is a 10% reduction in people's chance of surviving. 123 cancer operations cancelled in the last year in our area. One reason is because of a lack of investment by this government and its predecessors of all colours in radiotherapy. Would she agree to meet with me and Conservative and Labour members of the all-party group on radiotherapy that I chair to look at a way of solving this problem by investing in the kit that Britain so desperately needs to save lives?
Secretary of State.
Yes, well, I hope the honourable gentleman will be interested to know that we have made cancer waiting times, cancer treatment waiting times, a key focus of our elective recovery plan, and indeed that has been backed by an additional £8 billion in revenue funding across the spending review period. We have made progress by delivering record numbers of urgent cancer checks, with more than 2.9 million people seen in the 12 months up to October last year. But of course there is more to do. I will be very happy to meet him and colleagues across the House to discuss the practical ways in which treatment can reach our constituents, because he won't be surprised to know that cancer is a priority, not just for me personally, but for the government as a whole.
Will Quince.
I welcome my right honourable friend's statement. There is lots in here to welcome. I'd particularly like to welcome the additional 11,000 virtual ward beds. Hospital at home is hugely popular, and we know that it takes pressure off our hospitals, and I would like to thank all of the clinicians that help make that possible. Can my right honourable friend confirm it is her intention to now go further and roll this out to more hospitals and more specialties so more patients can recover at home?
Secretary of State.
Well, may I thank my right honourable friend for all of his work in making this possible, making this happen. Virtual wards were something that he worked so very hard on when he was Health Minister, and they are, I think, a real step change in how we treat people with long-term conditions who can be monitored safely at home, meaning that they don't have to spend time in hospital with all of the pressures that can mean for us as individuals, but also importantly, it frees up beds for other patients who need them. But I'm very, very keen to roll this out further, and indeed we have met not just our initial ambition, we've exceeded our initial ambition, and I'm able to confirm, as I did today, that we've delivered 11,000 places in the virtual bed ward category.
Live effort.
Thank you, Mr Deputy Speaker. The BMA say that junior doctor pay has been cut in real terms by 26% through consistent below-inflation increases. So if the Tories really cared about this strike and about the NHS, wouldn't they have avoided creating the circumstances that made junior doctors so angry that they felt the need to go on strike? And doesn't it just show you can't trust the Tories with the NHS?
Well, the figure that the BMA relies upon is in fact from 2008, when the party opposite were in government for the first 2 years, and they cite a 35% figure. Just to clarify, independent organisations such as Full Facts and the Institute for Government in fact rely on the CPI measure, which shows a difference of some 11 to 16%. So the Honourable Gentleman, I'm sure, will take into account the fact that we have already given first-year graduate doctors, first year out of medical school, a rise of some 10.3%, and I was willing to negotiate further and additional settlements that are fair and reasonable to the taxpayer.
Steve Double.
Thank you very much, Mr Deputy Speaker. Is the Health Secretary aware that the impact of these strikes on the Royal Cornwall Hospital Trust in Cornwall has been more than 7,000 appointments and operations have been cancelled and several £1 million extra cost to the Trust, and that's before the impact of the most recent strikes? Does she share my concern that whilst the junior doctors are pursuing an unreasonable pay demand, they're causing lasting damage to patients and indeed to the finances of the NHS?
Secretary of State.
Well, my honourable friend is a brilliant advocate at the challenges facing his rural and coastal community. We all know that geography is a factor in the difficulties of delivering healthcare in his corner of England. But everything that the Trust and the clinicians do is to try to improve healthcare for his constituents. I can't be the only one, I think, who felt uncomfortable at the image of some on the picket lines last week singing whilst our constituents were struggling with cancelled appointments and worried about urgent and emergency care times. I'm very keen that we reach fair and reasonable settlements with junior doctors, but they must act reasonably and change their minds and call off the strikes for that to happen.
Edwards.
Thank you, Mr Deputy Speaker. Recently, Tamworth had clarification that its mental health provision at the George Brine Centre would not be invested in. Patients must now travel to Stafford permanently for crisis care. Labour has pledged to recruit 8,500 more staff for community-based talking therapies and reduce their waiting times and reduce those crises. Why has the government not put in place a plan to recruit more NHS mental health staff?
Secretary of State.
We have, in the NHS long-term plan, we have set an ambition to grow the mental health workforce by an additional 27,000 staff between 2019-20 and 2023-24. This is in addition to the at least £2.3 billion of additional funding a year by March this year.
Holly Mumby-Croft.
Thank you, Mr Deputy Speaker. We're delighted to have our new CDC underway in Scunthorpe and, of course, our new A&E. But my right honourable friend will know that we're fighting incredibly hard to prevent the loss of some of our hospital services. Of the hundreds of local residents who responded to my survey, over 98% of them agreed with me that we mustn't lose these services. Does she agree with me that in order for the NHS to provide the resilience during the winter time and to provide the services it wishes to provide to patients, hospital bosses need to listen very, very carefully to what patients think.
Secretary of State.
Indeed, and may I thank my honourable friend for all of the hard work and advocacy she puts in on behalf of her constituents. If I may, I'm going to ask my ministerial friend, Minister Stevenson, to visit her hospital to discuss with her the concerns of local residents and to ensure that the Trust is aware of those concerns.
Richard Ford.
Thank you, Mr Deputy Speaker. I know of 2 GPs in Seaton, in my part of Devon, who moved to Australia to practice just a little over 2 years ago. Both are working as full-time GPs in Australia with no gaps in their career, and they now wish to return to East Devon to help ease winter pressures. Retesting when you return to England is lengthy, costly, bureaucratic, and does not take into account practice in similar primary care settings. Can NHS England not make it easier for UK-trained GPs working in Australia, New Zealand or Canada to return to general practice in England?
I think that's a very fair challenge, and I'm going to look into it, given that the honourable gentleman has raised it.
Alan Cairns.
Thank you, Mr Deputy Speaker. The Labour Party has been running the NHS in Wales for the last 27 years. The Shadow Secretary of State highlighted that he was frustrated with waits for ambulances, GPs and for operations. Can I point out politely to the honourable gentleman and to members that my constituents in the Vale of Glamorgan and across the whole of Wales are waiting much longer for ambulances, GPs and for operations. In fact, a quarter of my constituents and across the whole of Wales are on some NHS waiting lists. Can I also advise my right honourable friend that junior doctors and GPs are also in dispute in Wales in spite of the claims made by the benches opposite. So therefore, can I ask the Secretary of State to show some caution before taking advice from the honourable member?
Secretary of State.
Well, that is advice that I will receive and indeed follow with great enthusiasm. But I've got another statistic for him if you'd like to know. The Labour-run government in Wales were hiding 45,000 patients from their A&E waiting figures in the first half of 2023 because they were falsely claiming they performed better than England. So if this is the blueprint for how Labour run things, I think we should all be very worried if they were ever to win a government.
Alison McGovern.
Thank you, Mr Deputy Speaker. Further to the question just been asked by my friend for Tamworth, it was disappointing, I think, that mental health wasn't mentioned in the Secretary of State's contribution, because given rising levels of destitution and chronic bad housing in our country, mental health services have winter crises too these days. So can I ask the Secretary of State what progress she is making on developing proper waiting times for people in need of mental health services?
Secretary of State.
Well, can I reassure the Honourable Lady that the impact of mental health patients remaining in A&E for any length of time, let alone beyond the 72 hours, is genuinely a metric, a factor that we look at very carefully and have done throughout these strikes, because we appreciate, first of all, A&E is not the right environment for most people who are suffering from a mental health illness or who are suffering a psychotic episode, and we want to move them into appropriate care as quickly as we possibly and safely can do so. But with that in mind, I hope again she'll welcome the fact that we are spending some £7 million for up to 100 mental health ambulances over the next 2 years to try and ensure that they get the right care that they need when they need it. And also, more than 160 projects are being allocated with funding in the community, including, for example, crisis cafes and safe havens, so that people are not, that hopefully they are caught before that crisis happens and they end up in A&E.
Alberto Costa.
Thank you, Mr Deputy Speaker. Can I welcome the Secretary of State's winter update? There's actually a winter update going on in South Leicestershire, and I would ask the Secretary of State if she joins the local NHS stakeholders there and myself in encouraging South Leicestershire's constituents to respond to the consultation for the future of the Fielding Palmer Hospital. The deadline is the 14th of January. Would she join me and NHS stakeholders in encouraging that response?
I would be happy to do so, and may I say how pleased I am to hear of local NHS leaders actively seeking the views of patients and the communities they serve in order to ensure that their services are what the public expect from their local hospitals and primary care and secondary care services.
Justin Matters.
Thank you, Mr Deputy Speaker. I can remember a former Conservative Prime Minister promising to fix social care, yet I am still hearing of too many patients who are medically fit for discharge being stuck in hospital. Now, this time last year we had a record high of about 14,000 patients stuck in hospital who were fit for discharge. I wonder if the Secretary of State can tell us what the figure is at the moment, whether she expects it to go up or down before the end of the month.
Secretary of State.
Well, we are making progress on this. He'll appreciate that that figure alters not just day by day, but hour by hour. But the reason that we have been investing in social care packages is precisely because we understand the importance that being able to discharge people promptly and safely into the appropriate social care setting can have a huge impact on flow through the hospital. There are also other factors that can have an impact on flow, so very practical measures for people who perhaps don't need social care help when they leave hospital. We're looking at what we can do to improve those local factors as well. But he's right to acknowledge, make the point that the social care system goes hand in hand, if you like, with our NHS care and hospital care, and that's why we have been so keen this year to inject extra investment into social care to try and alleviate some of the issues he rightly raises.
Andrew Percy.
Thank you, Mr Deputy Speaker. The Shadow Secretary of State seemed to forget the 50,000 hospital beds Labour closed when they were in government, the thousands of mental health beds and the large number of wards they closed down, including at Goole Hospital. But I digress. I spent the Christmas on duty as a first responder in the Yorkshire Ambulance Service. You will know our friend, the Secondary Care Minister, does the same role in the North West Ambulance Service. So I can attest to the professionalism and dedication of our ambulance services, but also to our 999 dispatch centres and the clinical hub who support us at scene. And it is ambulance crews who not only bear the strain of winter pressures year in, year out, but will also bear the strain of this doctor strike. So can I urge her to once again pay tribute to their work, but also to look at what we can do, as I've said before in this place, to expand community paramedicine so more people, as demography changes and more older people are cared for at home, can be treated at scene rather than taken to A&E.
Well, I pay tribute to my honourable friend, both my honourable friends actually, for their work with first responders, and I would get into a lot of trouble in my own constituency if I didn't mention the wonderful lives who are community first responders and get to the scene of road accidents or emergency calls before ambulances and can conduct the most extraordinary and complex procedures very safely on patients when they need it. I was very pleased to visit very recently the London Ambulance Service to see for myself what teamwork across an ambulance service can achieve, but also the way in which these highly qualified, highly experienced individuals can make a real difference to people's lives, to their health after recovery. And I send my sincere thanks to everyone who has been working in those capacities over recent weeks and over the festive period.
Janet David.
Thank you, Mr Deputy Speaker. We've gone from no winter crisis when Labour left office to an annual winter crisis and now a crisis all year round under this Conservative government. Patient satisfaction with the NHS is at a record low. Instead of a blame culture, when will the Secretary of State accept responsibility for this appalling record?
Secretary of State.
I think the Honourable Lady is claiming that there was no winter under Labour, but perhaps that's yet another thing that doesn't quite stack up. In terms of the Honourable Lady's call for an end to blame culture, I fully endorse that. But I would also point her to the real and practical measures we have taken to improve NHS care in urgent and emergency care. And I assume she joins those of us on this side of the House in condemning the unprecedented strike actions that Junior Doctors Committee has called at this particular time of year.
Richard Graham.
Mr Deputy Speaker, this week, after chairing more than 150 meetings between Gloucestershire's MPs and our NHS leaders, I'm handing over the baton to my neighbour, the Honourable Member for Tewkesbury. And my Two thoughts are firstly to share the Secretary of State's immense gratitude to everyone in the Gloucestershire Royal Hospital and our other services for all their continuing amazing work. But secondly, to highlight that the biggest single impediment to reducing the elective surgery backlog, the hips, knees and much more of many of our constituents is this continued strike by doctors in training. And Mr. Deputy Speaker, I'm sorry, but the continued failure of the shadowed secretary to highlight whether he supports patients or strikers shows an absence of leadership. Would my right honourable friend confirm that actually the doctors in training, the doctors on strike, have already received in 2023 a pay rise of between 8.1 and 10.3%?
Secretary of State.
I most certainly can confirm that. They have already received it, and as I say, I was wanting to continue discussions on more fair and reasonable settlements for junior doctors, recognising as I do how tough their job is and the conditions under which they work. But may I thank my honourable friend for the local leadership he has shown with his local trusts and clinicians, but also agree with him that the one thing we haven't heard from the party opposite is that they condemn these strikes. They seem to prioritise union harmony over patient safety.
Helen Morgan.
Thank you, Mr Deputy Speaker. Shrewsbury and Telford Hospital Trust has one of the most challenged A&E departments in England for a number of reasons. In August last year, the government awarded a grant of £21 million to provide extra beds to ease some of those issues in the A&E, but those beds aren't online and operational yet. I wonder what assurances the Secretary of State can give to us that the measures that have been taken to ease winter pressures are going to be in place to actually help people before the winter's over.
Secretary of State.
So I will ask my right honourable friend to liaise with her directly. As I say, the latest figures I have from NHS England, working with local trusts, is that more than 3,000 of the extra 5,000 beds were in situ in December, and we expect the 5,000 deadline to be met very shortly. And so I hope she will be seeing that at local level in her hospital very, very soon.
James Wilde.
Thank you, Mr Deputy Speaker. Isn't the rejection by the BMA of derogation requests that are made on the basis of patient safety dangerously irresponsible? And rather than Dr Lawrenson, co-chairman of the Junior Doctors Committee, saying the NHS hates doctors, it is past time they called off this damaging strike action and put patients first.
Secretary of State.
Very much so, and you know, the NHS belongs to us all, as I say repeatedly, but of course it goes without saying that doctors are a critical part of our workforce. That is why, since I've become Secretary of State, I have wanted to have a constructive and good working relationship with all of the representatives of doctors and of the wider workforce. It was why I called in the BMA and indeed Agenda for Change as soon as I possibly could. And I'm pleased that I've been able to find fair and reasonable settlements with consultants and with specialty doctors. I very much hope that junior doctors will call off their strikes and come back round the table so we can find solutions for them too.
Samantha Dixon.
Thank you, Mr Deputy Speaker. The latest period of strike action by junior doctors has been the longest in the NHS's history. We've seen trusts declaring critical incidents and A&E departments telling patients not to come in unless their lives are under threat. Can the Secretary of State tell me why the Prime Minister has not stepped in to resolve this dispute? Does he not think it's serious enough?
Secretary of State.
As I've said earlier, Mr Deputy Speaker, strikes have very serious consequences for the NHS. We cannot pretend that the NHS can be switched on and off on a whim. And so my one ask of the Junior Doctors Committee was that they stop the strikes so that we can return to the table. The reason for this being that as the number of patient safety mitigations has revealed, which, by the way, is by a long stretch the highest number of patient safety mitigations that local NHS leaders have asked for because of the unprecedented length and timing of this strike. Because the BMA have refused even those derogations with the exception of 2, we have to get to a place where they return to a more reasonable frame of mind, they come back with reasonable expectations to the table, table and we can try and find a solution to this. But I will not put patient safety at risk. I have to enable NHS England to make the preparations, continue the work they are doing day by day, hour by hour, to safeguard hospitals and patients during this very damaging strike action.
Philip Holloway.
Right Honourable Friend, the Secretary of State, will be as concerned as my constituents in Kettering that for every 3 days of junior doctors' strikes, the cost to Kettering General Hospital is a staggering £250,000, with hundreds of operations cancelled or delayed for patients in pain. In confirming that the 35% pay demand is both unrealistic and unaffordable, will she call for the junior doctors to return to their posts so this money can be better spent on reducing waiting lists and improving patient outcomes?
Secretary of State.
My honourable friend puts it eloquently. There is a real human cost to these strike actions. It is why I did everything I could before, when we were in negotiations, to try to find fair and reasonable settlements for junior doctors. I was very, very disappointed when they walked out, but we have to find solutions for the sake of our patients and for the sake of all 1.3 million people working in our NHS across England. And there have been some brilliant examples of local trusts, local clinicians and other members of staff really working hard together, pulling together to cover these damaging strikes. But all we ask of junior doctors is to come back to work, do their jobs and look after our patients.
Dan Desi.
Thank you very much. Mr Deputy Speaker, NHS waiting lists have trebled since the Conservatives came to power almost 14 years ago. The Prime Minister's pledge to cut waiting lists has effectively been abandoned, with the government choosing to blame NHS staff instead of fixing the problems. Secretary of State, isn't it the case that the longer we give the Conservative government in power, the longer patients in Slough and across our country will sadly have to wait?
So waiting lists are coming down, but they are still too high. And towards the end of last year, we had a period without any strikes in the NHS, and we saw the waiting lists fall by tens of thousands, indeed by 65,000 over the period of October. That shows the impact of industrial action then. Sadly, we know more than 1.1 million appointments have been rescheduled in the last 12 months. It is having an impact on waiting lists, and for the sake of patients, we ask the junior doctors to come back to work.
Jack Burton.
Thank you, Mr Deputy Speaker. Can I firstly just thank Tracy Bullock, the Chief Executive of University Hospital North Midlands NHS Trust, who's announced her retirement today due to ill health. I wanted to also say that we've been making significant progress in North Staffordshire with improvements to health services. Particularly nursing vacancies have declined significantly over the last year, and also £4 million have been invested in improving urgent and emergency care services, freeing up some of those beds. But what puts this all at risk is these reckless strikes, because this is meaning that 867 appointments at the Royal Stoke have been cancelled, 38 operations. So would my right honourable friend agree that all this is put at risk, all the progress that we're making is put at risk by these reckless and unprofessional strikes?
Thank you, State.
First of all, may I join my honourable friend in thanking Ms Bullock for her work and her public service, and I very much wish her a speedy recovery. In terms of the progress made in his local area, he is right. There are some really, really encouraging signs for the future of the NHS, and all of the work that we've been doing, both across all of the recovery plans, whether it's for urgent and emergency care, for primary care, or for elective recovery plans. This is about embedding progress in the future of our NHS in this year of all years, as we celebrate 75 years of its establishment. But in terms of the impact of junior doctors' strikes, he is right to reference the number of new nurses and the progress that has been made locally. In fact, this year, we have been able to announce that we have met a manifesto commitment to recruit 50,000 more nurses. We made that promise in 2019. We have met it early, as well as the commitment to have 50 million more GP appointments than in 2019. 2 manifesto commitments made and 2 manifesto commitments kept.
Alex Sibbel.
Happy New Year, Mr Deputy Speaker. More and more of my constituents are waiting longer and longer for emergency care. In 2010, the target of emergency care was 95% within 4 hours. The government themselves watered down that target, 76%, are not meeting that. When will they meet their own target, and when can we expect to see 95% of my constituents being seen within 4 hours?
Well, I hope the honourable gentleman is injecting the same anguish into his conversations, which I imagine he's having with his local junior doctors, asking them to come back to work. Because, of course, having junior doctors not working in hospitals across the NHS has an impact. Of course it does. They are a vital part of our NHS. And so the attention of NHS leaders, of medical directors and of clinicians across the NHS over the last few weeks has had to be diverted towards covering this strike action rather than making the sorts of improvements and progress we all want to see across urgent and emergency care in line with our recovery plan.
Anna Firth.
Thank you and Happy New Year, Mr Speaker. The majority of NHS staff at Southend Hospital are working incredibly hard. Despite winter pressures and industrial action, they've used winter money to open a new ward, adding extra bed spaces. But the CEO has written to me to tell me he's extremely concerned. Now approaching 40,000 outpatient and inpatient appointments have been postponed across the Mid and South Essex Trust since this industrial action started. Now, given that we've learned this afternoon from the Secretary of State that doctors in training have received above inflation average pay rises of 9%, isn't it time these doctors simply got back to work, delivering the care my constituents deserve and pay for?
May I thank my honourable friend, and of course not only do we know, well, we know the figures for previous strike actions. Sadly, we will hear the true extent and impact of the strike actions of the last 6 days later this week. So we will have, I suspect, even more missed appointments, cancelled appointments to add to the list that she has rightly said. But just on this point of pay, the basic pay of a foundation year 1 doctor has risen by 10.3%. What that means is that the average salary, once one takes into account things like overtime, things like antisocial behaviour or unsocial hours payments, the average salary is £40,800. That is, I hope, a figure that begins to reflect the importance we put on doctors and their role in the NHS. But of course, we all know that as doctors progress with their careers, then they are on a they're on a good package of development and progress, culminating in the pay settlement that I hope consultants will vote for, that is currently out to ballot with the BMA for those who meet the very end of their career and who are doing so much to help train our younger doctors. So there is much work to be done. There's already progress that has been made in pay. That is why this was so very disappointing, the decision of the BMA and the Junior Doctors Committee to call strikes at this particular time of year and for the length that they have done so.
Order. I thank the Secretary of State for her statement and responding to questions, and to the opposition front bench our thanks also. Members would leave the chamber quietly, please. Move to the next item.